The general practitioner should always feel at liberty to ring the surgeon at any time. Probably the best time to ring the surgeon in a difficult problem or in a problem where it might not be obvious that a spine surgeon needs to be involved might be in initial consultations. I'd like to feel that I am freely available to general practitioners. If they wish to ring me, I always tell my staff that a general practitioner should always be put through to talk to me. And I'm happy to discuss problems, whatever they might be, a current patient or a potential patient, what the management program ought to be at that particular time. The time for surgical intervention is when the conservative modalities of treatment have been unsuccessful. We start out with anti-inflammatory agents, analgesia, physical therapy. Usually hydrotherapy is the best physical therapy for somebody with back pain and leg pain. If this is unsuccessful, then progressing to injection therapy in the form of periradicular injections or epidural injections or facet joint injections is the next option. If all this fails, then we have to consider the pros and cons of surgical intervention. Obviously, this doesn't suit everybody. Nobody wants to have an operation, but sometimes it's the route to take in managing the problem. The ideal referral is somebody who has been through the usual conservative modalities of treatment. In other words, that they've been the initial treatment with an anti-inflammatory agent, analgesia, physical therapy, perhaps in the form of hydrotherapy, has initially been undertaken. Investigations such as a plain X-ray, a CT scan, nuclear bone scan if appropriate, and an MRI scan with the films under the patient's arm when they come to see me is the ideal situation. Obviously, this is not always possible. In situations where the patient may have been injured at work, there's an insurance company in the background, and that can sometimes complicate the situation. But ideally, if the patient has had the normal conservative modalities of treatment and have the investigations as appropriate prior to their consultation, is the ideal referral. Most of my practice these days is in spine surgery. I operate from the foramen magnum down. So the typical patient that I see has neck pain and arm pain, or back pain and leg pain.